Good morning and welcome to ActSafe Injury Prevention Week's presentation of creating a psychologically healthy and safe workplace. My name is Ella Pritchard and I will be your moderator for this session. In any given week, approximately 500,000 employed Canadians are unable to work due to mental health problems. The current pandemic has added additional stress on our workforce. Therefore, having a workplace that encourages not only physical safety, but also mental well-being will help the workforce to pass the current hurdles successfully. Creating a psychologically healthy and safe workplace helps in enhancing worker health and contributes to overall organizational excellence. In this session, we'll look at the various indicators of psychological hazards. We'll discuss the 13 factors that impact psychological health and safety, and how to create a psychologically healthy and safe workplace. Presenting today is Manu Nalutla. Manu has CMHA certified psychological health and safety advisor and Canadian certified professional ergonomist designations, and he is the executive director here at ActSafe Safety Association. He has a varied background and extensive experience in the fields of physiotherapy, ergonomics, education, and not-for-profit management. He's very active in promoting ergonomics and has been a speaker at various conferences, including TEDx. He sits on the board of the Work Wellness Institute and is the president-elect for the Association of Canadian Ergonomists, BC Yukon region. So welcome, Manu, and over to you.
Thank you, Ella, and good morning, everyone. Hope the day has been good so far for you all. I'm just going to share here my screen. As you know, we are all trying our best to get used to the Zoom meeting still, no matter how many months it has been. So I'm going to share my screen here and I'll be presenting, and Ella will be giving me the cues as they come. So I will not be able to see you directly, but please feel free to reach out to Ella and let her know that you have a question, and then we will let her pass those questions to me, or you can directly ask those questions to me. So here is our topic for today: creating a psychologically healthy and safe workplace. Let's look at what we're going to talk today. So for the overview, we're going to talk about what is psychological health and safety in workplace. What does it mean? And what do you understand about that? And what it is according to the standard. We look at why is it important for us, not just during the COVID, but also normally too. And we will also talk about how to identify the gaps. And as Ella mentioned in the introduction, we're going to talk about the 13 factors that impact psychological health and safety. We'll also talk briefly about how to implement a psychological health and safety program at your workplace. And of course, there will be questions at the end that I'm open to take from you all. And meanwhile, in the middle of the presentation, if there is any question or something, I'll give you a chance to ask me, because I want this to be as interactive as possible. This is not a sprint, this is a marathon, so we want everybody to participate in this too. So let's get going. Psychologically healthy and safe workplace. So before I even start, I want to pose a question to you all. What, according to you, is a psychologically healthy and safe workplace? What do you think? Anybody? What do you mean by a psychologically healthy, safe workplace for you? Sorry, I'm looking at all of you on the screen here, on the screen. So anyone would like to give it a try?
Sure. I think it's a place where people feel safe.
Okay. Good. Yeah. People feel safe. Yeah, that's definitely. Yes. Erin, I see Erin. Yeah.
Hi, Manu. I believe it's an environment in which ideas are free to be expressed, to start.
And safely too, right? Ideas free to be expressed and safely, right?
Yes, without reprisal. Yeah.
Perfect. Now that's good. That's good. Anyone else before we go on?
Yeah, Manu, in the chat we had Thomas said free to share ideas and thoughts.
Oh, there you go. That goes similar to what Erin has mentioned there. So yes, it's definitely talking about sharing ideas safely and being safe. So mentally too. There is another thing. Workplace, a safe, psychologically healthy and safe workplace is a workplace that actively seeks to prevent harm to worker psychological health and promote psychological well-being. So it's not just about being safe or not, but also how to prevent the harm. So encouraging to share your ideas and at the same time making sure that there are processes in place whereby the mental health is not harmed too. So that's what being a psychologically healthy and safe workplace would mean. And this is according to the National Standard of Canada for Psychological Health and Safety in Workplace. If you type in CSA Z1003 in Google, you'll get the whole standard too. So according to them, that's the definition. So we are going to focus on these two things here today. Definitely, how are we going to promote the psychological well-being and also how to prevent harm to that worker psychological health. So these are the two aspects of any good psychologically healthy and safe workplace. So if somebody would say that, well, I have a great EAP program, fine, that's good. That's very good because you're promoting psychological health and safety, well-being, and etc. But also, how are you preventing a harm? Do you have policies in place? Do you have processes in place whereby if somebody feels bullied, he can go and complain or make a note to the supervisor? So that's what a psychologically healthy and safe workplace in holistic view would mean. And why is it important for us? Anybody? What do you think it's important for? Why are you all here today?
I,
Yes, Anna, go ahead.
it's important for longevity and sustainability. You know, I had to take a mental health, or I had to take time off from work because I was burnt out. So, you know, if you don't have that support or those systems in place, you can't sustain it for very long.
Totally true. It's a sustainable longevity and sustainability, right? Yeah, just as physical well-being, the more fit you are, the more longer the longevity of your life. Similarly, the more fit mentally you are, and the more healthier you are, not just fit, the more positively you can affect your work at your work too, right? Wonderful. Anybody else would like to go? Okay, no hit. If none, we'll just keep going for the time being. Again, you're more than happy, welcome to open up and ask me questions whenever I prompt you to ask. So feel free, and you can always chat and ask me to. So why is psychological health and safety important? Let's look at some statistics. Each year, 1 in 5 Canadians experiences mental illness or addiction problem, and that's huge, right? Like we talk about drug overdose, we talk about addictions, we talk about fatigue, mental fatigue, and etc. And you can see how it's affecting us directly. And this is surprising. Mental illness is the leading cause of disability in Canada. When we look at disabilities, we mostly think about the physical disabilities, amputations or physical limitations, etc. But mental illness is the leading cause of disability in Canada. And the economic burden too. It's $51 billion per year spent on on making sure that the mental illness is cured and providing support for those mentally struggling workers. And the cost of disability leave for a mental illness is about double the cost of a leave due to physical illness. That's a lot. Again, we focus so much on the physical safety, physical illness. We miss the point that the mental illness is causing us is the leading cause, and it also the cost of that is almost double that of physical illness. Hence, it's important. And as Ella mentioned in the introduction, in any given week, approximately 500,000 employed Canadians are unable to work due to mental health problems. Just imagine how much it's going to affect the productivity, the economy, and the overall the morale of the companies and etc. So it's important for us to understand that we need to focus on psychological health and safety too. And potential health costs, heart problems, psychological mental health issues also affect heart problems, back pain, mental health problems, and substance abuse. And not only it's because of the physical issues, but also because of the mental issues. And do you know that there are 3 times more heart problems for people who have mental health issues? 3 times more back pain. Can you imagine linking up from a physical aspect of a back pain to the mental health? But yes, If somebody has a mental health, they're mostly, maybe it's because of the way the morale is, the way they sit, everything, and the focus is different too, and they're not focusing on the physical health too. So that could be the reason why it also affects the back pain. Mental health problems, 2 to 3 times. And of course, substance abuse also increases because of psychologically wrong or not great workplace, health and safety workplace. We have a question here from the chat. What is that? Can I get Ella?
Yeah, so we have the question, has this changed over time? How does acknowledging mental health as important help workplaces?
Totally. I mean, I think we are happy that since at least for the past few years, there has been more talk about mental health and psychological health. If you talk about Canadian Mental Health Commission of Canada, they have come up with various initiatives. This session, again, the whole AIP week, Injury Prevention Week, has been on mental health. Again, we have been promoting mental health as much as possible uh, to highlight the importance of mental wellness and mental health. So I hope and things have been changing a lot. But again, what happens now is the pandemic. This year, as things have been improving, we have been focusing on mental health and everything. The pandemic changed this year, and that again caused more issues. So yeah, things are improving, but hopefully we will keep on going, and we'll learn more about how to help support our workers around their mental health. And of course, there is always that business case. I know, Anna, you're talking about longevity and productivity, etc., right? So, of course, psychologically health and a healthy and safe workplace will help out in risk mitigation, cost effectiveness. It helps out in recruitment and retention. Why not? More people will be there at the organization. And of course, it all contributes to organizational excellence and sustainability of that organization. So there is always the business case too. And add to that the work-related factors that add stress during COVID. COVID changed everything that we used to have in regards to mental health. Of course, it added anxiety or concern about risk of being exposed to virus at work. So it's not just about an unemployment. It's also, even if you're at work and you have to go back to work, the anxiety or concern about how much is the risk exposed, right? Transit, you need to travel in a transit, you need to go to the workplace. How clean is it? How sanitized it is? Those other factors now add further stress during COVID-19. Of course, there have been a lot of furloughs and layoffs during this season and during this period, and hence that adds to the stress. Return to work. Some of the industries are returning slowly back to work, especially our arts and entertainment industry. And that adds again the anxiety. How is the plan? How is the safety? Do I need to be with a person? How close am I? If I want to talk to you, to one of you, am I keeping the 6 feet distance or not? Do I need to wear a mask every time or not? So all those anxiety or concerns also affect even when you returning to work. And it's a different workload too. On addition of everything that you do, now you need to make sure that you sanitize, clean your desk and clean your workplace. So that's another additional step. Are you having the right supplies? Are you doing it properly? And is the other person who is responsible is also doing that properly or not? So it's a different workload now. And of course, we're also having stresses of learning new communication tools and technology during this time. There's the new word, the new, what is it? The quote of 2020 is "You're on mute," right? So even after 8 months, we still struggle. Where is the mute button? How to share the screen? It's a new technology for all of us. So yeah, so that's a added stress to our mental health during this time. And not to forget the family care and responsibility. We are all responsible for our families and making sure that now it's the school time, the schools have started back again, and making sure that they are safe. So on added responsibility of making sure that we drop this down at school at the right time, pick them up and etc., while making sure that your work is not affected. All these things kind of compound on during this COVID time too. So that's why psychological health and safety is very important for us. Any other factors that you think has affected us during this COVID? Anything else from your point of view? Anybody would like to go? Sorry, I'm looking at the screen here with everyone here. Yes, Anna. Yeah, I see your raised hand.
I think it's for me. It's will my industry return in the way that it was before? I'm an arts worker and I'm currently not working, so there's a lot of fear around having to change careers, and a career I've been doing for 15, 20 years. So that causes a lot of anxiety for me.
Totally, yeah. I mean, changing career itself is like, yeah, oh, that I can imagine. I can understand your pain. So, yeah, fingers crossed, Anna. We'll be back soon. Yep. Erin, I see Erin. Yep.
Um, I think because I work in an environment that has quite a lot of people, like there's 500, what I find impacts me is the anxiety that my coworkers have, and I'm calling it anxiety. They call it anxiety. You know, they're self-diagnosing, but the point is the worry that my coworkers have, and because it's such a large environment, we see these, you know, people have to quarantine because they've been potentially exposed, and we're seeing this happen, and it's a little like being in a minefield.
Mm-hmm. True, yeah, and it adds up too, right? You're concerned for yourself. You're also concerned for your colleagues too, and as Anna was talking about, it's the worry that will the industry come back or how it is. Like it's not just you now; it's the surroundings around you too, and then the co-workers are like your family too. Sometimes, right? You spend more time with them, so what's happening with them too? So that's a great point. Yes. Anyone else would like to go talk, mention something?
We have something in the chat here, Manu, from Thomas. Here in the States, we have contentious election in progress as well.
There you go. The
Another factor.
the environmental factors around us too, right? Like political environment versus natural environment. The fires in California, for example, the smoke that on top of everything, 2020 has given us. Oh, let's have some fires and smoke, and let's have some elections, right? So yes, all those again add that stress that is already work related, and then you have other stress factors too. Anyone else before we continue? I see Cecilia. Cecilia. Yep.
Hi, Manu. We're probably all so pressed for time normally, and it's just far, far, far worse now. Like you were saying before, there's so many more things to think about and reevaluate every day. So that makes it really challenging.
Totally, yeah. I mean, again, managing different workload too, right? Like time factor add into those things. Like you need to make sure that you whenever I leave my house to work or something, making sure that I take that extra minute to ensure that I have my mask ready, I have my sanitizer ready. All those everything, right? Simple things start adding up to that stress. So yeah, totally. Okay, so now that we understood what is psychologically healthy and safe workplace, it's not just having a good psychological health promotion, but also preventing harm. That's what is a good workplace to be. And we have identified why it's important and why it's more important during the COVID times, right? And so, but how do you identify the situation, even not during the COVID times? Because yes, COVID time has stressed us a lot on the mental health side, but what about the normal times too? So how do you identify the situation? So there are some indicators that you can easily identify that you can think that there is an issue coming up already. So let's go through some of them. Indicators to know that your workplace is not psychologically healthy and safe. Again, I want to highlight the point. Every workplace tries to be as much healthy and safe as possible, but at the same time, it's making sure that you have both the promotional and also the preventable activities available, or the processes at your workplace. So one of the indicators is definitely, of course, low productivity and frequently missed timelines. If they're continuously doing that, why is it happening? There could be something else than just the capacity or the skill set of the people who are in the workplace. It could be the environment, whether it's what is a very repulsive or kind of like tough environment to work with, then maybe, or there is too much workload that everybody's taking on and you're frequently missing those timelines. So that's one of the indicator for you to identify the workplace is not healthy and safe. Poor levels of worker engagement and low levels of job satisfaction. In any workplace, you need worker engagement and participation from the workers. And if you see that it's dropping, and when you identify that the job is not satisfying anymore for the people, then you know that there's something more than just the workload too. And of course, one of the indicators that you can easily identify is increased disability claims attributed to stress and mental distress. So as you can see, the claims are rising when you take a note and you see that the disability claims are due to stress, mental distress, then you know that, hey, something is not right at your workplace. And of course, frequent reports of workplace conflict. Conflict is a huge issue. And as Erin, we were talking about briefly previously about your question about around the co-workers. Workplace conflict is one of the highlight, like most important factor on mental stress at workplace. So yes, if you see frequent reports of workplace conflict, you know that something is not good. And when people have difficulties, or if the workplace has difficulties in returning to work, or if you see that people are going for longer durations of absences, then you know that there is something wrong at the workplace too, because they're not comfortable coming back to the workplace. So that's see, these are some of the indicators that we can always keep eye on and do that. At the same time, we can always conduct hazard analysis, just like investigation, right? So you have your joint health and safety committee reports, which talk about issues that are compounding at your workplace. And do you do worker exit interviews? Because that's a great time to understand if people are leaving your organization. You conduct an exit interview and identify what are the issues, and then maybe try to understand what's causing those workers to leave, right? Is it workload? Is it conflict? Is it supervisor inefficiency? Or is it their own personal struggles, etc.? So it's a great way to understand that too. And always look out for risk assessments, and if there is a incident happening, like a bullying harassment incident or something like that, then you can look into the instant investigation reports and identify that too. Of course, the other data that you can look is absenteeism. If you see that somebody is absent continuously, taking sick leaves or unpaid leaves, etc., too, then you know there is something wrong. And as we talked about, the other indicators, the claims data will also help you out. The more important thing that one of the most important thing that you can easily identify the situation is conducting employee surveys. These could be perception surveys or employee engagement surveys. How many of you actually conduct or had a uh, employee survey or perception survey or engagement survey at your workplace? How many of you? Oh, Erin does. Good. You want to show me your thumbs up or something, at least for people you want to react? Thumbs down there. Okay, I see one. Thumbs
Yeah,
down.
we have a no, another no as well in the chat.
True. See, that tells that, right? Like how to. It's important to identify the situation. It's not just about talking about the situation. It's also to identify where is the issue, what is the issue. Oh, we have a great EIP program. We have been paying into that for a long time. Is that the only thing that will help it out? Maybe the survey will find out something else, right? So, what else do you think could be the indicators? Do you have something in mind that you think could add to this list? Or you want to add to the suggestion of the employee surveys or something? Erin, you want to talk something? Yeah.
One of the things that we note, so I work in engagement, I work in the employee experience at, that's my role at work. And so one of the things we note is disruptor mentality that persists. So when you see people reject change consistently and push back and create perhaps like argument for argument's sake, we note that that's actually contributes to a poisonous feeling and can bring a lot of people down. And we tend to look at that as the person is the problem, but actually it's awareness and it's self-awareness and understanding how to keep yourself healthy. So there's an indicator is whether or not there are wellness programs or or whether or not there's information about how to stay mentally fit or improve your mental fitness, I think is a huge indicator. If the company doesn't talk about it, I think that there's, it's not intentional, but I think there's a sense of ignorance around what the problem is.
Totally true. And that's important, right? Being ignorant is the main issue there too. That's why identifying becomes the most important, not just to say that, oh, somebody else is doing this, so let us also do this the same way.
Right. Instead of seeing the complainer as the problem, perhaps identifying that the complainer needs support and those things. So thanks. Yeah.
Not even seeing them as a complainer, but seeing them as a feedback, right? Like it's not a complaint, it's something maybe he is struggling, so it's information.
Exactly.
even moving from that negative attitude of information, right, or feedback will change the attitude itself.
Thank you. Yes, exactly. It's that phraseology and understanding that feedback is not, the person is not the problem. So one of the things we do is keep anonymity in that so that people can evaluate the statement, not the person.
Totally great. Yeah. Anyone else? I see the chat going on there. So anything else, Ella, there? Any?
No, but there was a point earlier that Maureen had put in the chat about feeling isolated while working from home. So I think it's worth just noting that workplace isn't just an office, but it's remote workers too.
Wonderful there. Yes, definitely. Workplace doesn't mean the location of the workplace. Right now, I'm at my workplace, though it's remotely. So yes, definitely. That's a very great point, Maureen. And that adds compounds to the issues now. Now we are more apart from each other than especially during previously, at least we were all together at one place. Now we are all apart. So that actually compounds to the issue of gathering information and talking about psychological health and safety, right? So, well, I mean, thanks for your contributions. I mean, that's what that makes this presentation exciting, is you all contributing to that. So the best way to identify is to conduct analysis, do surveys, read your reports, conduct interviews, be there for them, ask them, let them provide you feedback and information, and not see them as a complainer, right? Complaining person, right? So now that we understood all these things, how do we think a workplace can actually uh, put in place a good healthy and safe workplace, psychologically health and safe workplace? So let's look into the next one. How do we turn on that switch so that organizations can look into implementing this program? Well, start always with participatory approach. I mean, there is nothing that the management can say that this is the way to go. No, always kind of talk, what is working for you guys? What is not working for you guys? If I'm in the management, I would say I'm thinking of this. What do you think? Do you think this can work? Let's get some feedback. Now, again, taking feedback may take a lot of time. So you may want to sample if it's a larger organization. But make sure it's a participatory approach. Involve the joint health and safety committee in that, which has both the workers representatives and the employer the management representatives. Come up with an action plan. List it out. What do you want to do? At the end of this session, we'll also go through the kind of steps that you can take to actually implement that. So we can go through the action plan for that. Provide resources, support. It's not just the talk, but walk the talk, right? So provide the resources that are available. And more importantly, understand the workplace factors that influence psychological health and safety. And because you need to identify them and reinforce the positive outcomes for the workplace factors. Then we are going to talk about the 13 psychological factors, psychosocial factors that affect at the workplace, right? So these are the kind of the overview of how to ensure that you have a participatory approach and making sure that everybody participates in that. I see a chat popping up. Ella, do you have a point there?
Yes, yeah. So just a note, it's also important to note that small organizations and nonprofits don't have the same financial and human resources for some of these things, which adds to the decline in mental health. And I also have a question that speaks to that. We don't have human resource capacity to start working on a program. Where can we look for assistance in developing the program?
Great question. See, the most important thing is the resources. As I said, provide resources, right? At the same time, the first, I didn't put the resources on the top for a reason. The first thing is participatory approach. Let's start with what we have, who we have, and opening it up to with them. I would say that would be the first step. Again, we'll talk about the steps as the factors as we look into that and how to implement that. But it's all about making a commitment and opening it up within the people who are available at that particular point. So if you're a team of 5 people, are the 5 workers or the 5 people open to share their challenges with them? Like, we are working remotely, as one of the chat came up, like we are working remotely. Does anybody say that, hey, I'm tired, I'm taking a break? Are they comfortable to even mention that, hey, I'm tired and I'm taking a break? So you need, yes, having resources would be great, somebody actually developing the policies, program, and etc. But it starts with somewhere. It starts from a starting point, from the seed, right? The whole tree grows from a seed. So it starts from that seed. So do we allow that does your workplace, even if it's small, allows that kind of collaboration, openness? I think that should be that could be the starting point. That's why I put the participatory approach on the top of this present of this slide, because it needs to be, even if you have policies, even if you have human resources and there is a handbook, there is policy and program, but there is no confidence given to your workers to say that, hey, talk to me. It's an open door policy, but is it open door process? Right? So it needs to be open and welcoming and constructive feedback and etc. too, right? So yeah, it's a challenge for smaller enterprises and companies, but hey, it starts from the same team that you all have. Come together, the five of you, talk and say, we are having it, we are having troubles right now. How can we support each other? That could be the first step, even to identify that there is trouble or there is challenges. I hope that answers the question there. Okay, so moving forward, now that we identify and we know how to implement, let's look into the 13 factors that actually affects the psychological health and safety. You can Google it out, and it's based on the National Standard of Canada for Psychological Health and Safety in the Workplace Standard. It's a national standard for the mental health side of things from CSA. And these are 13 workplace factors which they say that can impact on organizational health, health of individual employees, and also the financial bottom line. So it's very important for us to understand this, because what happens with these 13 factors is that these 13 factors could have negative or a positive effect. For example, if you don't focus on these organizational factors, it could be negative effect. And if you focus them properly, it can create a positive effect. So both the ways, it's important to understand what are these 13 factors. And you can pick and start working on those 13 factors and start building your program. So what are those factors that that are affecting psychological health and safety? Let's go through them briefly here. The first is organizational culture, psychological and social support, clear leadership and expectations, civility and respect, involvement and influence, recognition and reward, growth and development, psychological demands, workload management, engagement, balance, balance would mean work-life balance, etc., psychological protection, and not to forget the protection of physical safety, because you still need to be safe physically too. So that also becomes an important part. So these are the 13 workplace factors that affect psychological health and safety. What we're going to do in the next few minutes is going through each of these factors and understand how to make sure that they are looked upon in your organization. So the first one is organizational culture. What is a culture? It's a mix of norms, values, beliefs, or expectations of a group of people, right? So when an organization is what is it, characterized by trust, honesty, openness, and respect, where all are held accountable at the workplace for their workplace, then that creates a culture where people respect each other's ideas, values, and beliefs. There is trust between workers and management, and workers feel that they're part of a community at work. It's not just 9 to 5 or 8 to 4 job, but hey, I'm contributing something to this community because of the values and the beliefs that the organization goes through. That is a starting point for any organization to start with. You may have a great policy, but if nobody respects each other's ideas, or there is no trust, then the policy is of no use. So organizational culture is a very important factor. And where there is meaningful participation of employees in developing and updating those organizational values, that's much more, what is say, participation from them. So if you're developing your values, like what are your organizational values, get feedback from the team and ask them, what do you think are the most important thing for us as an organization? And then that's the better way to start looking at your culture, improving the culture. And of course, provide training for everyone in communication skills, conflict resolution, training, to be open, to be able to provide positive feedback, to be able to resolve a conflict, to be able to identify a conflict. So, and more importantly, when there is difficult situation, address them effectively. Don't postpone them, and etc. And timely manner and effective manner according to the process that you have developed. But yes, organizational culture would be that first what do you say, the encompassing thing that affects other factors too. But this is one of the most important workplace factors. I saw the chat pop up there. Ella, is there a question there?
No, not at the moment.
Oh, it's just a comment, maybe. Okay, sure.
Just
So,
a couple of people, just someone had to leave, so we're sending them a recording.
oh, okay, no issues. Thank you. So, yeah, so organizational culture is one of the important factors there. The second factor is psychological and social support. Of course, you always offer services and benefits that address worker health. But do you have a process in place to intervene if an employee looks distressed? It's an open question to you all. At your workplace, do you have a process whereby if you feel stressed or if you have difficulties, you're allowed to go and talk to your management? Anyone? What is the process? Do you have a process in place? Yes, go ahead.
We don't have a process in place, but it's a staff of 7 people. So I have weekly meetings with all my staff and a weekly staff meeting, and people seem free to tell me when they're having challenges either personally or with their work. So it seems to work.
No, that's a great point. I mean, that's a great starting point too, right? As I mentioned in the previously, when there are less resources, being open within your team and able to talk to your team is a great starting point. So good to know that. Erin, yes, please.
In a large organization, the bullying and harassment policy includes in ours, reaching out when you are feeling stressed. But I think what you're asking is if we observe others.
True. Yeah, that's what I want to say when we say, do you have a place to intervene if an employee looks distressed, like something we talk about mental health first aid, for example.
Right.
And first aid is something that happens after an injury or a cut, right? Whereas it should be early intervention, even before, like identifying the stress factors or the indicators and say, hey, I think Manu here is stressed because he has been absent from last few meetings and he has been late. Is something going on with him? So there should be a process to identify that too. Yeah, so that's what I meant to say when I asked, is there a process to? Yes. So good to hear that some things are happening, opening up, and that's where it will start up. And that's what makes it. Workers feel supported by the organization when they're dealing with personal or family issues. Like if somebody has a issue with their kids or like at school or something, and they come to you and say that, you know what, I may want to take 2 hours early because I would like to leave, like to check out my kid. I mean, how open is your organization to say that, oh, that's good, okay, fine, we can continue on this tomorrow, or maybe we can distribute this work with someone else if they're able to take that, versus, oh, is it? But this is the time, we need this report by tomorrow. So how open is your organization when people are dealing with personal or family issues? That is an important factor too. And workers are supported in returning to work after time off due to mental health condition too. So it's not just now, for example, because of the COVID, for example, we are trying to go back to work. And how are they supported during that time? And even if somebody had a mental health condition, when they're coming to back to work, how is the support systems around that in that organization also affects the workplace? So looking into that, what are some things that we can do? Provide education to reduce stigma. I think that's what we have been hearing. First is mental health awareness was the highlight in the beginning when we talked about psychological health and safety. But also that goes with mental health awareness is that prevent harm or reduce stigma. It's so the stigma to say that, oh, I'm feeling sad or I'm mentally fatigued is has to be encouraged to be talked about. Just as you're physically fatigued, your mental fatigue can also happen. So provide education to reduce stigma. And I'm glad that ActSafe has been doing these webinars to kind of raise that awareness. And this is it, all the educational resources that we have through the webinars to reduce that stigma related to mental illness. Provide mental health information and resources. There are so many resources. At the end of my slide, my presentation, I have a slide full of resources that I have kept, some organizations that you can tap into and share with your friends, colleagues. And of course, there is always the EAP in place in case employees need assistance in conversing and talking about the challenges. So that was the two important organizational culture and psychological support, but nothing is very successful if there is no clear leadership and expectations so that workers know what they're expected to do. Oh, we're going to help produce this production this in 2 months. At least they have a deadline, but how many are we going to produce? What if we don't produce that? What will happen? All that will affect the mentality, right? The mindset. So workers should be able to know what they're expected to do. And workers are informed about the important changes at work in a timely manner. Oh, by the way, we just changed from Slack to Microsoft Teams in our technology. I mean, you cannot just inform that. You need to make sure that there is a planned, staggered way, and there is a way to change your any changes. You need to inform in a timely manner beforehand. And supervisors provide helpful feedback on expected and actual performance. I want to ask how many of you have a performance evaluation at your workplace? Anyone in the chat or talking about that? Do you have a performance evaluation, and how often does that happen? Oh, okay, go ahead, Anna, please. Again, sorry to say, the 2020 quote, you're on mute.
Sorry. Sorry. We did at my former workplace. Unfortunately, it always seemed to get postponed. The model of the organization was me and one other staff person, and then a board of directors who are basically our volunteer employees. But unfortunately, due to people's overfilled schedules, those things just kept getting pushed and pushed and pushed. So yeah, yes and no, I suppose, is the answer.
That's interesting because you have a process, but how effective the process is also important too, right? Like how well it is run too. So yeah, good point there. Erin, you had something?
We have an annual review that everyone hates, and it's horribly ineffective. And it has a lot of biases built in that most of the time the managers they're supposed to be entering data along the year, but really what happens is they completely ignore the requirement until the month before it's due, and then they pile on whatever's happened recently. And if that recent thing is negative, then the employee who may be stellar gets a negative review because it's what have you done for me lately? And so there are many biases built in to this erroneous system. So yeah, reviews are very important, but especially if they're ineffective, they actually contribute negatively to what you're talking about today.
Totally, and that's the reason I didn't put a timeline there in that sentence there to say, do you provide feedback and on both expected and actual performance, not from a performance evaluation, annual performance evaluation, but feedback, and that could be timely at any time, right? Like we don't wait if our car engine is broken or something, we don't wait for the service time to come, but we do it immediately because we don't want it to affect our drive, right? So it's the same way. If there is a feedback that needs to be provided, it needs to be timely and effective too. Yeah.
I have a note in the chat from Thomas.
Yep.
We have annual reviews at our university. However, for many years, not really paid attention by our leaders. It's gotten better though. But like Erin mentioned, feedback is about what happened the month before, not over the entire year.
Totally, yeah, and that's the reason I'm saying it's that it should be. Are the supervisors also trained too, right, to provide that helpful feedback on expected and actual performance, and that too regularly? So don't wait for that last minute, but continuous feedback, weekly catch-ups, and just catch up, like even if it's not a performance, just kind of feedback. How are things going on? Is it good? Okay, good. Any challenges? Something that I could be helpful of? Is there any challenge with any other things that you have been involved in? So clear leadership and expectations is very important factor. It changes the morale of the employees. And of course, organization provides clear and effective communication. And what can you do other things to that? So include emotional intelligence training for leaders. So some, we have people in leadership positions with less training, and even if the training is there, it's mostly on management skills, performance management, product management, or time management. But they should be training on emotional intelligence too, to make them more than just the manager in there, but more like a leader. And that's why, and measure the leadership skills as a competence too. Are they supportive? Are they giving timely feedback or not? So your supervisors, so include in their evaluation, measure leadership skills. And again, review positions regularly for relevance to organizational goals. Is this position still relevant or not? And make changes that is relevant. Just because it has been there, we have these positions, doesn't mean that they have to continue the same way. It should be dynamic and fluid to go with the times. And I think COVID actually kind of reminded us that the positions could be more flexible, and this is the time to reevaluate how many or who we need in which position and how well we are fit to run this organization. So yeah, so just wrapping up, clear leadership and expectations, and thanks for your contribution. As discussed, the performance evaluation should not be just at the end of the year, but it should be continuous too. Let's look at another workplace factor, which is civility and respect. This is important because we work as a family, and as we say, we spend more time with each other. So workers treat each other with respect and consideration in the workplace. It's not that somebody is in a lower position or higher position. I'm the supervisor. You're just an administrative assistant or something. But there should be respect and understanding that everybody plays an important role. Again, this starts from the leadership. Leadership has to show that just because I'm the owner or I'm the leader, I get to go everything. Like you need to still submit your health declaration form if you're coming back, if you're going to work every day during COVID times. Not just because you're the leader, you're exempted by that. So everybody treats and respects each other. An organization effectively handles conflict between stakeholders. And when I say stakeholders, it could be internal stakeholders or it could be external, like clients, etc. too. So there should be a process, and it handles effectively. Because if conflict is not handled, it kind of boils continuously, and it spills over, and it becomes very tough to handle. So timely and effectively handling the conflict is important too. And of course, this is the time, very important time for us to talk about diversity and inclusion um, during the current times too. And workers from all backgrounds are treated fairly and respectfully. And of course, organization has effective ways of addressing inappropriate behavior by both customers or clients, not just internal, but also external too. So if your front desk administrator has to receive people who are very rude, uh, it's not just that you have to always keep smiling. It affects her or his mental health too. So you need to stand up for your front desk people and address those inappropriate behaviors that come across from even customers. Sometimes longevity, as one of the comment came up, your longevity of your employees is more important than just to that one particular customer probably. So keep that in mind and look at civility and respect, and how does your workplace reflect these points here. And of course, always provide training and resources to support problem solving will also help it out. Moving forward, psychological demands is an important point. So how many of you are allowed to redesign your work based on your work assessment? Anybody? Like, are you allowed to say that, okay, this is becoming a bit too much for us. Let's maybe change the timings here or the workload or etc. Are you flexible enough to do? Is there flexibility in your timings? I see a thumbs up. That's good. Okay. I see a kind of, I know Anna is not agreeing with that. And that's what we want to know, right? Like, are you allowed to do that? Do you have job control or autonomy in decisions, like those things, right? And they become important in the psychological demands too. Like, are you able to take your decisions to say that, you know what, today I will just rest at this point, but I'll come back tomorrow and do this, finish of this job. So do you have that? And put a high emphasis on interpersonal competencies in recruitment and training, right? So always ensure that when you're recruiting, the organizations, workplaces are recruiting, yeah, there is a not just skill set. Oh, somebody is very highly skilled. We always talk about this, right? One star player versus the whole team, how they all contribute. So you may have the best star player, but if that player doesn't have an interpersonal competencies, how to respect each other and talk to each other, that's not going to help the whole team. So always look into making sure that you put that emphasis on interpersonal competencies too, and value worker input during periods of change. Like this is a period of change. Like it's everybody's struggling. Just send an email, or just acknowledge on your Slack or Teams, just to say that, hey, great work there, good job, thank you. Just acknowledge and value their input too. You know what, Manu, I think we need a poster here which says that we should have social distancing. We need a poster on the door here. Let's get it, because that's important, right? It's to remind. So value any input that comes at this point, and encourage their demands, and allow for work redesign based on the demand assessment and etc. And have autonomy. Let them have some autonomy around that, because you already have the job skills and the job descriptions, but within that job description, how they actually conduct the job, let there be some flexibility around that. Let's go to the next point here, and then we'll again take a quick check on how things are going on so far. Growth and development. Workers receive feedback regularly, and supervisors are open to their ideas. This is similar to the one previously we talked about, leadership expectations, right? But at the same time, does the workers receive feedback regularly? And we talked about the annual performance reviews or end of contract reviews, etc. No, it should be weekly, regularly. And supervisors are also open to their ideas. It's not that one-way traffic, but it should be both the ways too. Feedback is always, there is that back loop that comes back to you. So you should be open for that feedback. Involve workers in exploring areas of professional development. How many of you actually have professional development training for you guys? Do you have them? Like, do you have those professional development opportunities? Yes, I see a thumbs up there. Yes, great. And how many times no, okay, that's okay, Anna. The things will improve, right? And how many of you actually are involved in the discussion? What is good for you? Yeah, Erin, you want to talk about that?
Oh yeah, it's just it's easy for me to be involved in that because I'm a consultant. So, however, the place that I work doesn't necessarily involve their people. They actually see training and development as a cost and a perk. So we're working on that.
Sure, yeah. Again, that's important, right? It's not just one side, but it should be more like, okay, this is what the training I think you should get it based on your evaluation. What do you think? Okay, let's plan for that. Oh, I'm also interested in something to get on Microsoft Excel. Oh, that's interesting. Okay, let's think about that. Being open to that and helping out in making them participate in what makes their job easier. Because you may say, let's go with Microsoft Access, but they're saying, no, I think Microsoft Excel is enough for me to start with. Let me get that training first. Why not? So being open in that becomes helpful. And consider job shadowing, mentoring, job sharing to provide opportunities for growth. Just because you're in one role doesn't mean that you cannot do the other role. So you can always look at opportunities to shadow others. Like, for example, we have safety advisors, and they're also great at uh, marketing side of the things too. We need them on the to market our products too. Can they job shadow, or the vice versa? Marketing team shadowing the safety advisors, and there could be opportunities for growth in that way too. So again, opening it up so that your skills, the worker skills, are developed. So encourage them with those things. Any questions so far? Are you guys along with me, understanding, going through this? Different factors. Each factor has either a negative factor or a positive factor. So if you have the past 5 factors we talked about, but no proper plan on growth and development, on job rotations, job training, and etc., that one will impact negatively. So each factor will either have a positive impact or a negative impact. And that's why it's important for us to understand all those factors and identify them. Moving on, growth and development followed by recognition and reward. Why not, right? Like, do you provide fair compensation, or is there any difference between gender or race, etc.? No, they should be fair compensation so that Same level managers or the same positions should have the same level workers should have the same kind of compensation based on their job position, of course. But if there are two people at the same thing, maybe there should be fair compensation based on their experience, at the same time, uh, their qualifications. Celebrate shared accomplishment. How many times do you have say that, oh, person X, Joe, has done this. Joe can never do that without his team members' help. Joe, yes, Joe is in the forefront. Manu is in the forefront, but Manu is not successful just because Manu does everything. No, I have the whole, the wheels and the engine and the doors and the wipers, everything working together for the car to move. So celebrate those shared accomplishment, identify everyone else's contribution to that, and appreciate their contribution. And always educate supervisors on motivation and constructive feedback. If you are in a supervisory role, ask for the training. How can you provide good feedback? How can you motivate others? It's not just the management side, it's the leadership skills too, right? So it's not managing something, it's also how to motivate and how to provide feedback is important. So how many of you have anything else in recognition and reward? Do you reward your co-workers, or like what are some of the things, the way you encourage others? Anyone? I like there is something in Teams, Microsoft Teams, which is called kudos. There's a nice sticker that you can give and say, hey, kudos to Ella for doing this. Thank you. It's a nice way to encourage people in that way. So anything else on something like that? Even that small note makes somebody feel accomplished, that they have contributed something to that process, right? So recognition and reward becomes very important too, is a very important factor. It could be promotion, it could be what do you say, pay rise, anything, but continue with that recognition and reward aspect. And if you don't do that, negative effects. That's why I'm saying these factors either have a positive effect or a negative effect if you ignore them. It's not like if you implement them, it's only positive, but if you don't implement them, there will be a negative impact of that too. Next factor, involvement influence. This is very similar to participatory approach, right? Workers are able to control on how they organize their work. Don't be a micromanager. You given them the job description, you given them the skills, they have the skill set, they have the capacity, provide them the resources, leave them. Let them become Einsteins, let them become Newtons, right? So, because at the end of the day, it helps your organization and the cause that you're trying to put it out there. So they should be able to control on how they organize their work. Some of them, for example, myself, I prefer working. I'm very productive. I see myself between like just around 4:30 to 5:30 in the evening when everybody's actually closing down. Maybe quiet time probably, but that's when I'm more active. But somebody else is more active at 7 to 8 in the morning. How flexible is your work schedule to? I know in arts and entertainment sometimes it's difficult, but still thinking of how they can organize that. Somebody who is, I need a cup of coffee, then I'll get going. Help them out. It could be anything, but how much control they have is important. And of course, we talked about it very frequently again and again. Constructive feedback is reciprocal. Oh, you're doing good job. It's not just the supervisor telling, but the worker may also appreciate the supervisor too. At the end of the day, the supervisor is part of the team. So it goes both the ways too. And if the supervisor is always telling you're doing a great job and never gets a feedback that, hey, you know what, supervisor, thank you for your support, it's affecting his or her mental health too. So, which again contributes to that overall team's mental health, right? The organizational culture. So constructive feedback is both the ways. And always encourage input from all the workers on important decisions related to their work. Always, how do you think it's working for you? Do you have anything to change in this? Oh, I think I may need a new laptop. Okay, sure. It's not in the budget, but can we look into other things? But encourage them, input, let them give that input, and let them take some of the important decisions. I may be a safety advisor, but I may not be good at marketing. Let the marketing person take that decision sometimes. Yes, there is discussion, but let them take those decisions. And always, worker opinions and suggestions are considered with respect to work. Keep that work in the center of that. I have a chat here. Something popped up here. Any comment on there, Ella?
No, not to me. Maybe it was something to you privately.
Oh, okay. I will see if that's something I can click quickly on. Oh, no, there is something here to everyone. Was it an older one then? Okay, sorry.
Yeah.
No issues. I will trust you that you will provide me the feedback when and as needed, Ella.
I shall.
Great. So moving forward, last few factors. Workload management. Making sure that the workload, the amount of expected work is reasonable for the position. Now, this is very important because we talked about physical fatigue and mental fatigue. This factor is very important. There is always work to be done. There is always work to be done. If it's not finishing today, there is something else piles up tomorrow morning. But how are you managing it? Are you able to say that, prioritize your workload? Are you able to allow your worker to prioritize that workload? Because you may say that I want these three things to be done by tomorrow morning, and then okay, that's fine, stop there. Don't tell I want this by 10 o'clock, this by 11 o'clock, this by 12 o'clock. No, you want by tomorrow morning. Let the worker prioritize them because they have their own work schedules, their own, the best times of the day, the best way of doing this. Let them take over that, and give them that flexibility and give them the resources that they need to do them well. And exactly, worker has control on prioritizing tasks when facing multiple demands. They should be able to say what is important for me, how to prioritize them, and provide education to workers on time and stress management. Very important. We have seen organizations being continuously successful because of the workload, but at the same, I'm putting because of the work output. But how much stress it puts on them, and how do they manage their time? We never know. So encourage, provide them the training on how to manage their time and also how to manage their stress. And inform and prepare workers for anticipated increases in workloads and plan distribution accordingly. You know what? Coming in December, we are going to have 2 more new productions coming up. Yeah, with the COVID right now, we have an extra process in place whereby everybody has to check in before you come into the theater, something like that. But prepare them and inform the workers of anticipated risks, increase in workload, so that they can plan how to distribute that properly. 10th one, most important. I have been talking it again and again, but again, these are all interlinked factors, as I mentioned, right? So worker engagement. And a successful, a good, healthy, and safe workplace is where workers are committed to the success of the organization and willing to give extra effort if needed. Now, we're not talking about workload, or we're not talking about fatigue here. We're talking about who are committed. You know what? Let me stay 1 more hour and get this done, and then I'll relax tomorrow. Right? I can be free tomorrow. This is very important. These AIP webinars are very important for ACSAFE. Let's organize them. Let's give an extra hour or two here and there, and then we will be successful. Then we can take rest at the later time. If you're not able to do, don't do it too at the same time. Workers are not only engaged physically, but also emotionally and cognitively. So it's not that you're physically present there, but you need to understand, why am I doing this? Well, how is it going to? How is my role helping my other fellow workers, etc.? And regular acknowledgement of workers' contribution. We talked about the recognition and reward. And involve workers in work design and encourage them to apply their strengths. So again, not I've been stressing again and again, but worker engagement becomes very important in that. Coming to the most, I feel, one of the important factors, balance. Encourage workers to take their entitled breaks, lunchtime, vacation time, and not work while taking a break. How many of you don't check that email while you're eating lunch? How many of you actually does? I'm guilty of that. Actually, I type in Microsoft in Slack or Teams that, hey, I'm on lunch break. And then I'm replying to somebody's email there to say that, oh, that looks great, good. But encouraging that work-life balance is important. Commitment, everybody's committed, but tell them, take a break. Hey, you have been sitting for a long time. Why don't you go for a walk and come back? You know what? We have been planning this out for past 2 months. Why don't we take a quick 2-3 day break and get back on Monday and start fresh again? Encourage those work-life balance. promote life and work harmony. There's only 8 hours that we contribute to the work. There are 16 more hours outside of that. So how do you balance that harmony? What else do you do to balance that? Build health promotion and wellness practices. Maybe introduce an early morning stretch for everyone. Go for walks. Do you have, I know it's a mandatory 30-minute lunchtime, but how many of you have an extra 15-minute or 30 minutes extra to encourage people to take a break and go for a walk? Does anybody have it at your workplace? Yes, good. That's something to encourage them too. So build health promotion and wellness practices. You encourage workers to take vacation. Hey, I noticed that you didn't take vacation from past 3 months. Take a break. Go. Work can wait. Take a break, because I would better want a well-oiled machine to be back than a troublesome machine at my work. I mean, not machine, but a well-rested a person, right? And be fresh and come back. That's much more better in that way. Provide flexible work arrangements where possible. Flexibility could be time-wise. Flexibility could be based on where you work from. Flexibility could be on the work that you do itself, on the amount of work that you do itself. There could be flexible arrangements too, because every person is different. I may be able to sit through for 3 hours and get my work done. Somebody may be able to do it in chunks of work, right? Like bites and pieces. So encourage that flexibility. I have a comment here. I think there is a chat here. Comment. What is that like?
Yeah, that's from Thomas, and it's just a note to your first point that he was saying that he turns his work emails off on his phone over the weekends and evenings when there are no productions on stage.
I wish that would be the golden rule for everyone. I wish. Actually, we should maybe have the. There is something actually. Yes, you're right, Thomas. I mean, we can actually do that voluntarily too. The notifications, turn them off. But again, the commitment sometimes takes us away from that, right? But at the same time, how much you're spending that time, and how the leadership encourages it too. Like, it may be bad. I feel sometimes guilty myself too when I chat something in the evening to say, hey, I want an answer from this. And immediately my expectation is that, oh, don't worry, you can answer in the morning. Then another side of me says, why did you even type it then? Like, you could wait in the morning and type. So yes, it's very important to manage that work-life balance and encourage our workers to do that too. And psychological protection, more important, commitment to minimizing unnecessary stress at work. I think in the starting, somebody said that apart from everything that's happening in the COVID, now there is elections time in US, for example, or fires. And I mean, even in BC now we have elections coming up in next month. So again, it's some additional stress probably because of all these things factoring outside the work too. So how can we minimize it is important. Commitment to that, and very important. Put efforts to prevent harm. It's not just, hey, we have a EAP, we have a break, we encourage breaks, but also do you have processes to prevent that harm from happening? Harassment, bullying, discrimination. So how do you do that? Provide training, develop policies, encourage them to talk, have processes in place that will identify before something happens to. And more importantly, the last one, protection of physical safety. Don't forget that. It's always there. So commitment to and create an occupational health and safety program. How many of you with your raised hand or thumbs up have it's something which is like a health and safety program? Good, good. Few of you. Good. Start from there. And if you don't have, don't worry. You know, that's where ACSAFE comes in to help you out, right? So don't worry, we'll be helping you out with that. Identify hazards and introduce controls to prevent physical harm as part of your health and safety program. And there is a lot, fall protection, PPE, and etc. There's a lot of things already in place, so that's good. Workers are encouraged to stop or refuse unsafe work. It includes not just the physical side too, but also mental side too. You know, hey, I think that client is very harsh on me. I would like to take I think I will not be in a position to talk to him. Great. Let me have Manu deal with them. Let me have Ella deal with them. Maybe not Anand, like, so make sure that you change, workers are encouraged to talk about that. Encourage rest periods, both for physical and mental health, and demonstrate that all health and safety concerns are taken previously. It's okay, it's just an annual drill of earthquake drill that happens once every year in October. No, take it seriously, because what if it happens tomorrow? You need to have a plan in place and make sure that plan works. So take everything seriously. So these are some of the the 13 factors that affect psychological health and safety. And I will tell you one thing, there is no golden rule on where to start with. You can start with any of these factors and start looking into what works well for you and start looking what doesn't and start implementing them. And to implement a program, there are few steps that you can start with. First is problem recognition, as we talked. Employee surveys, have those joint health and safety committee reports, and then start with a policy commitment statement. Provide a statement from the leadership to say that our organization is committed for a good health to make our workplace a psychologically healthy and safe workplace. Sign it. Let everyone sign it. All the workers sign it. Why not just the policy maker? Let everybody be an ambassador to that. And then next step is worker participation. Include them. Anna, you were telling your, or somebody was telling you're only a team of 7 people. That's a great start, right? Like let's start with those 7 people. Let everybody work together and participate together, and let's contribute to that. And step 4, planning and assessing the needs. We have these 13 factors that affect. Let's look at each of these factors and say, do we have a recognition program in place? Do we have a a rewarding program in place? Do we have training on what is it, providing constructive feedback? So start assessing and planning those needs. And well, then comes implementation. So implementation, I'm not telling you start today because some things are already happening around, but start planning, identifying, plan what works for you. And then of course, always evaluate. Is this working or not? We introduced a new performance evaluation last year. Is it working or not? We introduced a reward system. Is it working or not? So get feedback and correct those actions and always review and making sure that you have a good program in place. And as I mentioned again, it's not a everything doesn't happen immediately. Start with that one box that you open and then start in looking into various factors and make sure that we have a good what is psychologically healthy and safe workplace. Any questions at this point or comments? Anna, please. Yes.
I just wonder, so when you're talking about implementing policies or programs, I just have a question. So what if every time you think there's something that the organization needs to do better? So for example, implementing this type of program that you suggest it to your managers and then they say, okay, why don't you get started on that? But then you're just adding to your already overloaded workload, and it's so you sort of feel afraid to ask them to do these things because you know it's just going to get piled onto your already overfull plate.
Yeah, great question. Again, if it comes from you, it's different. If it comes from the managers themselves, like from the workers themselves, then it's different, right? And that shows commitment and participation. And then you can say, hey, you know what? We already have this workload here, but you want this training. How do you think we can manage that? Involve them in that training, in the planning. And say that maybe, you know what, maybe the training is not for one full day, but maybe we can ask if we can do 1 hour daily over the week and get the training and not affecting the whole productivity here too. So maybe that could be a possibility.
Well, I don't really mean training. I mean, like whatever it is to make your workplace something that's easier to, less stress on your mental health. And, I've had experience in small organizations where when you suggest something like that, they just tell you to do it. Okay, you do it then. And you're like, well, I'm seeking your help, but they just sort of push it aside and ask you to do it rather than have, work out and that might be more, might be easier for you. So then you don't ask for those things because you just know it's going to get put on your plate anyway. So you just sort of, you deal and you push it aside, and then of course it all piles up, and then, yeah.
I got the question. Yeah, but I think Erin wants to comment on that. She has been.
Okay.
That. Yeah.
I've been waving my arms. I have now this may not work. My first suggestion would be to form a posse. So one of the things that you can do to persuade or manage up in this case is to not present it as your idea, but present it as a group need. And so you must sort of, let's just put it this way, the more voices that can add to your argument. So if you're just noticing, if you're the expert in the room and you can see that this is a real issue and something needs to be done, and you cannot add that responsibility to what you're already doing, then take the time to do maybe just one lunch and learn or one information session, or even just share a website that contains some of the information. Even this perhaps presentation will have some documents you can share, and share it with your group and say, can we agree that some actions are required, and collect that. Just take half an hour to an hour to do that, and then bring that forward, so that it's not, okay, go for it. It's, you know, and present the actions that are required of the manager, and use, you know, the managing up techniques of persuasion and a sense of urgency, and getting them to understand that they will benefit if they take this on.
Okay, that's very helpful. Thank you.
Yeah, again, it's worker participation. It's them involving, getting them involved, and them taking the decisions, right? And making them feel participatory and owning it up. So yeah, different techniques. Again, it differs from place to place. Again, large enterprise versus smaller organization, etc. too. So yeah, great question there. So yeah, so moving forward, again, I have provided here on the slide here a lot of resources. I would encourage you to go and check them out. The national standard that I was talking about is in the middle here. That's from the CSA group. But the 13 factors are available on any of these websites. They all talk about that. And this webinar will also be on our ACT Safety Association. And we also have a psychological safety toolkit on our website. And that's a toolkit developed by BC Municipal Safety Association, and we collaborated with them on that. So you can have that toolkit as an extra help too. And yeah, I mean, please go through these websites, and I myself am trained by CMHA as a certified psychological health and safety advisor. So shoot emails to me. You know, we may chat. Again, it's not a one solution fits everybody. I'm also an ergonomist, so I'll always look into how it can fit for you, right? Now, so we'll look into that. And yeah, I'm open for questions. Thank you for listening to me all this while, and sitting through this session. And you can add me on LinkedIn, and I'm on Twitter too. So reach out to me. And any questions apart from the wonderful questions and the suggestions and interactivity we had so far?
Thanks, Manu. I do have one in the group chat here from Zoe. What are your thoughts on evaluating if you might not have a baseline?
Perfect. Again, I didn't want to go more into the audit and gap analysis kind of things to start with, but the national standard already have an audit sample, and you can get that from Guarding Mindset Work or from CMHA website. It's called an audit sample. It gives you an idea to say that, okay, to identify the gaps. That you can kind of check and say that and identify where your gaps are. That could be a good starting point. At the same time, the 13 factors, lay them out and say that, okay, do we have a reward or recognition system? No. Okay, that's a starting point to say that we have a gap here. Do we have a policy statement? No. Okay, we have a gap there. So that could be another way of kind of identifying those 13 factors and what gaps you have and what you already have something in place. We have a performance evaluation. Great. Check mark. But do we do it regularly? Nah. Do the other managers trained to do that regularly? Nah. So you can now, that becomes your gap analysis, right? So that could be a good point to start with. Any other questions?
No. Okay, great. Thank you, Manu.
Thank you.
Our time here has come to an end. If you would like to learn more about this subject, please visit us at actsafe.ca, where we'll have additional resources and links, as Manu mentioned, also to all of our other Injury Prevention Week presenters' websites. One of the best ways of dealing with mental health awareness is by showing support to everyone working to make a difference. On behalf of Manu and ACT Safety Association, I'd like to thank you for joining us today and supporting our annual Safety Week initiative. Thank you and take care.